Before I go in the patient's room, I would check the charting to see what their care plan is pertaining to their wound care, and I would also put on proper PPE if needed. Hi, my name is Alyssa. I'm going to be your student nurse today working alongside Dr. Robinson. Can I please see your bracelet? Can you tell me your full name and date of birth? Okay, and today we are going to be doing a dressing change on your wound and your abdomen. Are you currently in any pain? Alrighty, so I'm going to start off by raising your bed up. I'm going to wash my hands and put on my clean gloves. So first off, I'm going to start off by lifting up your gown, and we're going to take off your old bandage. I would use the push and pull method, so pushing down on the skin, pulling up on the tape. I would assess the gauze and the bandage for the fluid on it, the type, the amount, the color, and if there was any odor, which there is none noted. And then I would also measure the wound. I would note that it is about 12 centimeters by like 0.1 centimeters, and if it was depth, I would measure sticking a Q-tip in. I'm going to take off my clean gloves, and I'm going to prepare my tape. And then with all my sterile products, I would make sure that they're all unopened and that they have a valid unexpired date on them. And then I would grab my gauze, my abdominal pad, my lubricating jelly, and then my cotton swabs. And then I would put on my sterile gloves. And then I make sure there's no tears in my gloves. I would start by grabbing the cotton swab, wiping it in the lubricating jelly, wiping the wound. Then I would take 2 gauze pads. And then I'd cover it up with the abdominal pad. And then I would use my tape to hold it down. piece of tape, I would write my initials, the date and the time. And then I would take off my gloves, wash my hands. I would cover up the patient, get them comfortable again. I'd lower the bed all the way down. I'd put the side rails down, make sure the wheels are locked and the call light is within reach. And I'd clean up my supplies and ask my patient if they needed anything else before leaving the room.